Hello everybody. In this video today, we are going to discuss healthcare cost in USA. I have data from CMS, Center for Medicare and Medicaid Services, and this data is actually from 2016. We will discuss some of those details and we'll also discuss what are the causes for the healthcare costs, high healthcare costs. So in 2016, the healthcare cost in United States, it jumped from previous year, which is from 2015 to 2016, it jumped 4.3% and became $3.3 trillion. And the per capita, per person, healthcare cost is 10,348. Yes, so per person we are spending 10,348. That's the highest in the world. And when we get the 2017 data, I'm pretty sure it's going to be even much higher. This $3.3 trillion figure, that amounts to 17.9% of the GDP. So 2016's GDP, 17.9% was spent on the healthcare. That was the GDP. That was the portion of the GDP. So the basic assumption would be that since we are spending so much on the healthcare costs, if we are spending so much on healthcare, so we should be better off. We should be one of the best country in the world. But that's not true. Compared to other developed countries, we fall in almost all matrices. So we are behind in life expectancy compared to some of the developed countries like Germany, Japan, Australia, Switzerland. We have per capita hospital beds, that's also lower side in the US. So we have less hospital beds per capita than in other developed countries. Then healthcare coverage. So healthcare coverage is also less here. Most of the developed countries, they have 100% coverage. We don't have 100% coverage. There is only one metrics where we are leading, and that's number of deaths by preventable disease. So number of deaths by preventable disease, we are actually ahead of other developed countries. And that's a shame, because if we spend so much money on healthcare, then we should be able to prevent those deaths, but we are not able to because we don't have coverage for the people who need that coverage. So what are the reasons for higher healthcare costs here in USA? So some of the reasons I noted down. First, the most important reason, which I feel, okay, personally I feel, is that apathy of consumers. Consumers don't even care. They don't even check the price list. And hospitals, providers, they don't even show the prices. When we go to hospital, when we go to get our healthcare services, we don't know how much we or somebody else is going to pay for this treatment. So apathy of consumers, in my mind, is number one reason. The second one is higher cost of medical education. That's also one of the highest. In some of the developed countries, actually education is free. So you can get good education. You don't have to worry too much about paying your loans and then try to get as much money as you want from your patients. That's not the concerns, because your education is free or cheap, much cheaper. The high admin cost. So administration cost in USA also is pretty high. It's very high. Then the higher drug prices. So we American consumers, they pay actually the highest cost for pharmacies, highest cost. So that's one of the reason. Then defensive medicines, the hospitals, clinicians, providers, what they do is they know that we live in a litigious society, so there might be some litigation. So why worry about it? Let's recommend some of the tests which consumer may not need, but those are defensive tests, defensive medical tests, just to make sure that okay, all the tests were done. So there are a ton of tests which may not be needed. There are a ton of drugs which may not be needed. There are a ton of procedures which may not be needed. We take all those things. and that basically adds up to the healthcare costs. Then fraud, waste, and abuse. One of the biggest white collar crime in USA is fraud, waste, and abuse of healthcare system. That runs in billions of dollars. So that's also one of the reason. We will discuss all these things in my upcoming videos. So please subscribe, please follow me, and we will discuss all those things in my upcoming videos. Thank you.